Welcome to Clyde Ellis Medically Speaking and our special series on the fight against the coronavirus. As you can see, we have modified our format to practice safe social distancing while providing timely and factual updates from the Clyde Health team during this public health crisis. We as a healthcare organization believe it's important for the Western New York community to hear from our medical experts who are leading the charge in our facilities and with our workforce of over 10,000 strong. I'm Mike Hughes, and this is Medically Speaking. Welcome to Medically Speaking. Today's guest, Dr. Mona Bonanno, is a newborn hospitalist and the Medical Director of Pediatric Services at Millard Suburban Hospital. Dr. Bonanno, thanks for joining us today.
Thanks for having me on, Mike.
So obviously during the coronavirus, it's a very stressful time. It's probably much more added stress for moms and dads who are expecting either their first child or having another baby. So if you can talk a little bit about some of the things that you're dealing with from a stress perspective for expecting moms.
Sure, and I think that anxiety is really understandable for everybody in our community, but especially for moms who are bringing a new baby into the world. One of the things I think a lot of moms are concerned about is whether or not they, if they do contract COVID-19 during their pregnancy, can they pass it to their baby either during the pregnancy or at the time of delivery? And that's called vertical transmission. And unfortunately, the answer to that isn't clear just yet. Early reports out of China suggested that vertical transmission was not observed, but more recent reports suggest that it may be a possibility. However, babies, when they're born at term, have really fared fairly well and not really become seriously ill. There have been some very sparse reports of young infants becoming ill, but we don't know how the infection would have been transmitted to them, or if they had any other underlying illnesses that potentially could have contributed to them becoming more seriously affected.
So, how is the baby cared for if mom has COVID and she comes in to either deliver the baby or even before that, if mom contracts COVID-19 and she's pregnant?
So when a mom comes in to deliver, I think regardless of whether or not vertical transmission is really the key, what we do know about COVID-19 is that it is spread by respiratory droplets and saliva coming into contact with mucous membranes in our faces, and that applies to newborns as well. So the way the baby is cared for is really going to depend very much on how ill mom is when she comes in to deliver. If she's very acutely ill and she's not able to take care of the baby, then we may consider temporarily separating the baby in an effort to minimize the baby's exposure to those respiratory and salivary droplets. The baby will be tested and the baby will be cared for by a nurse who is responsible only for that baby. We know that babies have immature or very naive immune systems. So really the bottom line is we can't let our guard down. We have to be extremely cautious about transmitting any infection to the babies. If mom is at a point in her illness where she's either recovering or maybe she's tested positive, but she isn't really seriously ill, then she should wear a mask whenever she's within 6 feet of the baby and also practice meticulous hand washing before she cares for the baby.
So mom delivers, she brings the baby home, whether she had COVID-19 or not. How should the baby be cared for, when they get home? How do you assure the baby's safety when the baby comes home?
So that's a really good question, and I think bringing a new baby home is a time really to celebrate. It's a time that a lot of people want to share with their friends and family, but at this point in time, the safest option is really not to have any visitors coming in to see the baby. We have to be very cautious about practicing the recommendations that have been set forth by our experts at the health department and our state and local governments to practice social distancing, physical distancing. And again, if a parent leaves the house to go to the grocery store or to pick up supplies for the baby, wear a mask, practice physical distancing when you're at the store, and make sure you don't touch your hands to your face, because we know that that this virus can be transmitted through contact with contaminated surfaces. So if we touch something and then bring our hands to our eyes, our nose, or our mouth, then that virus gains entry. And once it does so, it can begin to attach to the cells in the mucous membranes and begin to multiply, and that's ultimately what causes an infection. So if we protect ourselves, if moms and dads protect themselves, they're effectively shielding everyone else in the household and not allowing that virus really to breach our defenses. And if we practice careful prevention ourselves, and our neighbors practice careful prevention on the one side, and our other neighbors practice careful prevention on the other side, then that's how we keep the community safe and reduce the disease burden in the community.
So even if you do take all those precautions, there's still that added stress of having a newborn in the house. This next stress level for mom or dad is, should they be looking for specific symptoms for the baby to make sure that he or she doesn't have COVID-19?
Yeah, I think although it's my heartfelt hope that no parent ever does have to worry about that here in our community, as long as we practice those preventative guidelines and measures. But I do think it's important for parents to know what to look for. And one of the earliest signs and symptoms in a baby, if you're concerned that they might have been exposed somehow to COVID-19 or to any respiratory illness, is a decrease in a baby's activity level. They might seem sort of more tired than usual, sleepier than usual, not willing to feed as well. Any fever over 100 is concerning, or 99 if it's checked under the arm. And certainly any changes in their breathing patterns, faster breathing, or any concern about labored breathing, where they seem to be working harder to bring air into their lungs. Those are all signs and symptoms that warrant an immediate phone call to your pediatrician or your baby's doctor. And it's very important right now that we make that phone call first and not just bring the baby into the office unannounced, because your pediatrician or your baby's doctor is really your partner in this crisis, and they will help to determine where the best place is for your baby to be evaluated and best looked after and cared for.
Sure. So as we wrap up here, there's an awful lot of stress in the community with the coronavirus, but you're dealing with a whole level of anxiety for expectant moms with or without the coronavirus. If you can, some parting words of advice for moms and dads who may be expecting a child during this time of uncertainty.
Number one, know that you have partners in the medical community who are here to help take care of you through this, and we want to see you get through this as safely as possible. So don't ever be afraid to reach out. We understand that there's a great deal of anxiety about this virus in the community. And it is our objective to get you through this as safely as possible. The most important parting words of advice I have are really to protect yourself. Take those recommendations seriously. Do not be lax about them, and that's how you're going to protect your family. And as a community, each of us has a responsibility to adhere to those recommendations so that we not only protect our own families, but we protect all of the vulnerable people in our community.
Great. Well, Doc, we know these are busy times for you. We do appreciate you taking time out of your schedule to join us today and give us some advice on moms and dads and expecting babies in this time of turmoil for the community. So thanks again.
Thank you.